Hi guys!
Hello everyone!
Oh my god, I'm so happy to be able to do this live. Welcome to Health Talks, our monthly talk about health. We have different topics and I'm here. I'm going to introduce him right away. Let me read it. Dr. Stephen Noel Henry, an Orthopedic Sports Medicine specialist at the University of Miami Health System Sports Medicine Institute.
Yes,
Did I say it right?
you got it. You got everything in that one title there. Yes.
Perfect. We're in Miami. Look at this, weather here, palm trees and the sun. So we are very, very blessed to be here. Thank you for all your shares or all your likes. You can send us your questions here. We'll read it online. Mm-hmm. And later on, this is going to be posted forever. And we have on Facebook page, we have a list of videos with all the UMiami doctors.
Yep.
Unbelievable, so you can check them out later. So let's talk about injuries, doctor.
Excellent.
Because when it comes to, when we're talking about heat and cold therapy for injuries, the only thing I know is that I use hot therapy when I get my period. That's an injury for me because I'm in pain and I know that I have to apply hot.
Right.
But I had an injury. It was like a year that I was in pain. I had plantar fasciitis because I was running and I had that. So let's talk about injuries let's talk about cold therapy first, so people can just know about it.
Sure.
Because cold and hot therapy are different stuff.
Yes. So for general indications for hot therapy, if you have some sort of muscle strain, muscle spasm. Generally speaking, if you have what we call a bursitis, or fasciitis, like what you had, just to loosen up the soft tissue. And heat works by basically loosening soft tissue, and even though it brings and increases blood flow to the area, that ability to loosen up the soft tissue helps with the overall healing process. So our main goal with heat is to attack and improve blood supply to the area so that we can increase your chances of healing. So that's why when you get like a quad strain or a muscle strain, or if you say have a little bit of blood collected in the area, we tend to try to use heat.
Closer.
There we go.
Closer to me, doctor. Okay, so you apply that.
So you apply. But you have to think about the type of heat, right? So you have two types. You either have a superficial heat therapy, which is what we're used to. We put a hot pack on, leave it be, or we have deep heat therapy, and that's where you see folks with sport injuries or the athletes, they'll use an ultrasound that can apply the heat wave to apply deep down to the tissue. So it all depends. But of course, it's not for everyone, so you have to be aware of the contraindications.
So
right?
those are the types of hot therapy that we can have if we are injured.
If you're injured, superficial, right? Either you put a hot pack. Sometimes we can do hydrotherapy, where you get when you go to the spa, they'll have the hydrotherapy where you can get in the water and it applies that heat to your area of concern. So that's basically the two types. Now, for the deep therapy, the deeper application of the heat, you can use the ultrasound, and some of our physical therapists here and our athletic training staff, they use it daily for some of our athletes that are getting better.
That's quite dangerous to have like equipment like that at home and do it at home, because I've seen people doing it.
Yeah, you can get hurt.
You can get hurt, right?
And so that's why we recommend that prior to starting, as simple as it is, a lot of people apply the heat for too long of a time and they end up with a burn, and then you're susceptible to infections, etc. So we really want folks to make sure they meet with a sports medicine specialist before they start any of this, because what you think that is just a simple injury may be something more complicated and needs a little bit advanced care. So that's why you should come in and see us when you can.
Talking about that, doctor, I'm going to give them, the phone number. You can call 305-689-3627, or you can visit doctors.UMiamiHealth.org, and you complete an online form, and then you get your appointment.
Right.
Doctor, what are the conditions when to use, hot therapy?
Right, so the general conditions, one of the things you can use hot therapy for, interestingly enough, is fibromyalgia. Now, everyone is, a lot of folks have that, and so if you can apply...
What is that, doctor?
So fibromyalgia is basically where you have multiple areas on your joints where you start feeling aches and pains. And sometimes it can affect you in terms of your spirits. You may feel depressed, moody, just being in constant pain. So generally speaking, I'll send my patients with fibromyalgia to hydrotherapy because it can attack their whole body. Now, you have to be aware that if you have a sensitive skin, if you have a history of cancer, if you have a history of like bleeding problems, you generally should try to avoid, heat therapy. So that's why you should come in and see a doctor so we can, what we call a risk stratify. In other words, figure out where you fall on the platform and see if you'd be a good candidate for some of these therapies. It's not just slapping, a hot pack on your knee. If you have an underlying bleeding problem, then you may not want to slap a hot pack on your knee.
So once you see your doctor, you can do a home therapy, either heat or cold, but you need to see the doctor to be able to figure what to do with your injury.
Exactly. And so, and 9 times out of 10, we're designing personalized exercise programs along with the hot and the cold therapy to help you to get back to your sport of choice. And you don't have to be an athlete. Everyone sees sports medicine, they're like, oh, I'm not competing, I'm not doing anything like that. But we just want to keep you active. That's our goal. So if we can get you on board with using these simple measures, applying the hot pack to an area of injured tissue, but doing it in a safe manner, then I think that would be a good option for folks out there.
I think it's very important because even though I'm not an athlete, but I like to work out.
I like to work out too.
Exactly, but as you age,
acquire wisdom. As you acquire wisdom.
Exactly.
That's what I believe
as
in.
You age.
Acquire wisdom. There is no aging here. Okay?
You need to be aware and you need to know your body, and the doctors you guys are there for that.
Yes.
It happened to me, 1 year doctor of this plantar fasciitis killing me, going to different, therapies, and it wasn't working for me until I got, the right, doctor treatment. And it started to, get better.
And what we want folks to realize is while we have these modalities as hot and cold therapy, your problem may be multifactorial, meaning you may have foot pain and there's something going on with your hip. Or you may have knee pain and there's something going on, with your hip and your back. So we need to look at you as a whole person. And that's why I emphasize that, yes, it's cool to use this at home acutely, but try to make sure you see a sports medicine specialist like ourselves because we look at the whole picture. Do you
use any products or creams or something different?
Yeah, the over-the-counter, there's plenty of hot packs out there.
Yes.
Of course, the famous one out there is the Icy Hot, and that's more so when we talk about some of the cold applications. There is capsaicin cream. That's another one where it's in Tiger Balm. You've heard of Tiger Balm before?
Yeah, that's what my grandma used to. The Tiger Balm.
Exactly.
It's an old cream.
Exactly. So what we want from our patients is for you to know how to safely use these over-the-counter products. Because now they have things like lidocaine patches and all this stuff, which if you don't know, you may put patches all over your body and think you're fine and you're no pain, but pain is what your body uses to tell you, hey, come and see the doctor. So again, that's the key right there. Just focus on coordinating your care with a sports medicine specialist.
And we need to listen to our bodies.
Listen to your body. All I do as a physician is help you figure out how to heal on your own. I'm not doing anything, miraculous here. My goal is to say, hey, how can I help you understand your body, and we take this journey to help you to heal. Especially
if you are frustrated, because when you're in pain, the mental state is difficult, doctor. It's very difficult when you're healing, when you're dealing with pain.
Yeah, pain not only affects you to complete your daily tasks, but it also affects you on the psychiatric level where you start to feel, I feel down, my spirits are down, etc. Exactly. So again, just come in and see us. And of course, if you have an acute injury, applying ice to a basic muscle strain is not an issue. If you have, say, you felt like you pulled your calf, something like that, you can put some ice or heat on there. And we'll kind of talk about when to use what, but generally speaking, you can use both, but there's some major contraindications that I mentioned. So with the heat, again, if someone has a history of blood circulatory problems, avoid the heat. If they have a history of what we call ischemia, which is you lack the ability to deliver oxygen to your working muscles, I would try to watch how much heat therapy you use, or use it under the supervision of a physician. Yes. If you have a lot of scar tissue after an injury, you may not want to apply a lot of heat to that area. So you have some contraindications there that you and your physicians hopefully you give me an opportunity to be your sports doc, I can be there for you.
Can you be mine? Like I said, like
you have the number now.
Like a meme that I read, like I have more issues than Vogue.
That's funny. I'm gonna use that one.
Yeah. And before switching to cold therapy, I want to thank you for being here. Hi, Kathy Gonzalez. And I'm going to say something in Spanish now. Si hablas español, no te preocupes que después yo pongo esto con los subtítulos para que puedas entender todo. Como sabrás, muchos de los doctores aquí en Estados Unidos no hablan español. It's okay. Así que más tarde lo voy a poner en español. ¿Estás aprendiendo?
Estoy aprendiendo. So está bien.
La próxima vez lo hacemos en español. I like that. I like bilingual doctors. Because sometimes, you know, you need things in Spanish. Even though you're bilingual, I like my Spanish too. Okay, let's talk now about cold therapy.
Yes. So cold therapy, generally speaking, we try to use the cold therapy to be able to calm down the inflammation. Okay. So, for example, if there's a lot of swelling in an area, we can apply the ice or any sort of cold, liquid. If you see that, if someone has like long-standing issues and you're responding, for example, some people with arthritis, they may respond better to, the cold therapy than warm therapy. And then, interestingly enough, I don't know if you notice, so a lot of people, when it gets a little bit colder, the arthritis flares up, and they're like, "Oh, I'm not going to apply the ice." Yes. It just depends on how your body responds. Some people respond better to the cold. Some people respond better to application of the cold therapy. Others respond to the heat. So that's one of the things. If you have an acute trauma, applying ice, meaning like you're running, you hurt yourself, you see a big swelling there, ice is what you want to apply right away to calm that down. If your muscle is, has a spasm, you can apply ice to it.
Okay.
The way that works is that the ice constricts the blood vessels, and what it does by constricting the blood vessels, it kind of forces that muscle to spontaneously relax, and it decreases the ability of your nerves in the muscle to detect pain. So if you can have temporary relief of pain while you seek care, remember, while you seek care, you apply whatever the modality is, heat or ice, and then figure out how to see a doctor. If you can use that ice to calm down the pain, see a physician, then, that's a safe way, generally speaking, to go about using cold therapy. It's
been very trendy, the cryotherapy.
Right.
Let's talk about that, because there's a lot of rumors that it doesn't work, that is, a scam. What do you think about cryotherapy?
It just depends. The elite athletes, the first studies that were published about cryotherapy were actually in Europe on elite athletes, and we saw that they were able to recover quickly, especially after intense workouts. So if it's a tough day, you're really going at it with a run, taking a cold shower is actually a form of cryotherapy, if you think about it.
Exactly. You don't need to go to a fancy place.
You don't need to go to a fancy place and go in a big machine and have them drop the temperature, down. So cryotherapy, I believe in it. I just think that we need more evidence, more documented studies to show over long term what it's actually doing. So we use it, and this is where the personalized aspect comes, because medicine is an art.
Yes, it is.
So if I try something and it works for you, I'm just going to try it in a controlled manner. That's really what it is. But I have to personalize your care. I have to know what your medical problems are. If you have general problems, some people have cold allergies, meaning that when they go into cold, they start bumping up, they become worse, they feel nauseous. If you have a cold allergy, I'm not going to tell you.
I've never heard about that.
Some people
probably I do have something like that, because I start sneezing when I'm in the cold.
It's possible. Some people have what we call Raynaud's phenomenon, meaning Raynaud's disease is where your blood vessels are already getting smaller just on their own. So if I put ice on it, and your blood vessels constrict, what's going to happen? I'm going to be in pain. So if I have a disease that naturally causes my blood vessels to constrict, and now I take ice, which in itself causes blood vessel to get smaller, constriction, and more, that's going to lead to more pain. Again, that's why you need a physician to come in and say, hey, that may not be a good option for you. I'm all for ice. I'm all for applying ice. No more than 10 minutes, because more than 10 minutes, again, you predispose yourself to a burn. You can get you can injure the skin.
So every injury is different.
Every injury is different.
Probably you have an injury here, and then it's cold here and hot in here, and then
exactly. So we can kind of mix up what we do for you. So it all depends. Now, that's, it just becomes a very personalized approach.
We are in UMiami. This is Health Talks. I'm very happy to be able to be here with Dr. Stephen Noel Henry, an orthopedic sports medicine specialist at the University of Miami Health System Sports Medicine Institute. You can book an appointment with Dr. Henry by calling 305-689-3627 or by visiting this website. I'm gonna post it later, doctors.umiamihealth.org. Okay, let's talk about mixing both therapies.
So mixing both now, for example, if you're let's paint a scenario. You injured your muscle, it's acutely injured, and I see that there's a lot of swelling there. I'm going to apply ice to be able to control that swelling in that area. But in the rehab process, when I want to improve blood flow weeks later to the area, I can start applying that heat therapy. I can put you in a hydro bath. I can put warm compresses on the area. We can, and if during that process I see that you've flared up your injury again, I can now apply some more ice. So it becomes a mix and match depending on what the situation calls for. If I see there's a lot of inflammation in that area, I can use some ice to calm it down. If I want to improve blood supply and improve your chances of recovering and healing, I can now apply some some warm compresses. So that's generally what I do. I try to, depending on what the patient's body is saying to me, I listen to it and then we move forward.
So this life is for people who are athletes, or if you work out every day and you have an injury. Also for people like, sometimes I think, doctor, you don't have to be an athlete, as you said before, to have something in your body that is not working and you're in pain. So do you have people who come here who has like a, how do you call it, something that is regularly, the pain? Yeah,
so that's where we talk about earlier, those people with fibromyalgia. They're in chronic pain all the time. No, there are some conditions that can predispose you, can let you have pain, musculoskeletal pain. So for example, some of my diabetic patients, they'll come in with a lot of shoulder pain.
Okay.
And even though I may tell them, hey, put a little ice on the shoulder to calm the inflammation down, the problem with that is if I don't control their sugar levels, then they're going to continue to have the inflammation, right? And the pain may even be worse, because sometimes their pain can get so bad that their shoulder is frozen. In that case, if their shoulder is frozen, I'm not going to tell them to put ice. I want to put a warm compress to be able to move the shoulder. So that's a situation where you have a general medical problem, and it presents as a musculoskeletal problem, which is why you need a physician to come in to try to say, hey, what do you have? Because if you're in pain all over, maybe it's not just a little ache and pain you have from running or working out. Maybe something deeper is going on. And that's where we personalize your care.
I guess you have a lot of patients that are runners.
Yeah,
because I that's when I got my injury. Yeah. So, what's the patients? What are they concerned about?
Mostly my runners, we worry about overuse. The plantar fasciitis is a common one. I see that, unfortunately. A lot of knee pain, so they have what we call patellofemoral syndrome, where your kneecap doesn't track properly because you have weak muscles around. They injure the quad muscles.
Why do we keep running if it's not good for you?
The runner's high.
I don't understand.
The runner's high, yeah.
There's somebody there who's a runner.
It's, the studies have shown that when you exercise, it's going to fight depression.
You burn a lot of calories.
Burn calories, so if you want to have your ice cream or you want to cheat a little on your meal, it helps you way to get rid of that.
So we have to deal with the pain.
For runners, there's going to be some level of discomfort if you're amping up your miles. But if you come into us, we can help you to design a program to safely increase your miles weekly.
That's what I need to do, because I want to be able to run again. I've been doing, doctor, like the machine that you run.
Treadmill.
The treadmill, not the elliptical. The treadmill, but just short, like 20 minutes only, on and off. But there's a problem. This is a pain for runners. On the other side, I've seen my other friends who they do yoga or Pilates,
Right.
they have a lot of bursitis.
Yeah, they have a lot of bursitis in the hip. So the folks that do yoga, Pilates, or a lot of weight training, a lot of times you're walking around with weak hip muscles. So if you come in, we assess you, we can design a program to strengthen.
That's
those
what I was
muscles.
going to say. You have to tell your patients what exercise is good for them or not.
Exactly, because there are so many different exercises out there, and once you come in, you sit with us, we can work with our exercise specialists or physical therapists to be able to design a program that's good for you. And you can just come in for an exercise assessment, see what your capacity is to push it, as much as you want to. And so, or even if you're starting to think about exercising, you come in, I'll assess you, see if your heart and everything else can tolerate the level of activity you want to do. Then we can safely start that. So it's more than just, again, looking on Dr. Google, which is awesome. I love that people have access to the resources.
But it's good, but it's not good because your mind is like, oh my God, I'm going to die now.
Exactly, yeah, right now. After looking this up.
On Google, I'm going to die. Thank you, doctor, for your time. I really learned a lot about it. When we finish this, I'm going to ask you some questions about myself. Yeah. But thank you guys for being here. If you like this video, please share it. Share the knowledge. We are very privileged to be able to interview doctors, not trainers. It's not like they have the knowledge as well, but this kind of doctor like Dr. Henry. Yes. Why did I call you Dr. Henry? It is. It's okay. I was like, okay, Dr. Henry.
No, I have three first names, so
like
people.
Me, I'm Laura, Cristina, Giovanna.
People they call me Dr. Stephen, Dr. Noel. Hey, just to be your doctor is a privilege, and so I work with all the. It's not just me; it's a team of people. We have athletic trainers, physical therapists, nutrition specialists. We have other doctors. That if someone is obese, we can maybe help you to lose weight to get moving. So it's multidisciplinary. That's what I want the viewers to realize. So don't think that because you haven't moved for a while, we can't get you moving. Come and see us.
That's good. That's good. Thank you so much. Right. Thank you so much, doctor, for your time, because I know that it's lunchtime for you. Thank you, guys. Right. I'm gonna just go to the live like this.
All right, guys. This is
Thank you, doctor.
Peace out. Take care.